ప్రపంచ మహమ్మారి కరోనా నుంచి దేశాన్ని కాపాడడానికి భారత ప్రభుత్వం చేపట్టిన చర్యలు సత్ఫలితాలిస్తున్నందున ప్రపంచమంతా భారత్ వైపు చూస్తోందని కేంద్ర ఆరోగ్య శాఖ మంత్రి డాక్టర్ హర్షవర్ధన్ తెలిపారు. సరైన సమయంలో రాష్ట్రాలను అప్రమత్తం చేసి కట్టుదిట్టమైన చర్యలు చేపట్టినందునే ఇది సాధ్యమైందన్నారు. కరోనా కారణంగా దెబ్బతిన్న ఆర్థిక వ్యవస్థను తిరిగి ప్రగతి పథంలో నడిపించడంపై దృష్టి సారించాలని ఈటీవీ భారత్కి ఇచ్చిన ప్రత్యేక ముఖాముఖిలో కేంద్ర మంత్రి పేర్కొన్నారు.
These are tough times for all of us. Everybody wants to know where do we in India stand presently with regards to COVID-19. So is your government confident that the situation is under control? Because what we are seeing is that the graph is still increasing. So where do we stand with regards to the numbers which is increasing and controlling these numbers?
These are tough times not only for India but for the whole world. India was the first country in the whole world to have responded to the news of a coronavirus outbreak in China. On 7th of January this year, China had informed the World Health Organization. India, within less than 24 hours, in my own health ministry, we had called a meeting of our experts. Within the next 8 to 10 days, we drafted detailed advisory for all our states, screened almost 20 lakh people and had put almost 10 lakh people under community surveillance. We stand ahead of everyone else in the whole world. We have the least mortality rate in the whole world. We have a doubling rate of 11-12 days. Over 30% of our patients have recovered. Within this short span of 3 to 4 months, from one lab, we have expanded our capacity to almost over 450 labs in the country. So everything is crystal clear in terms of our strategy and in terms of our success.
With concern to India, is the rise in the number of cases more evident in the respective increase in the corresponding testing centers?
You see, there is not a significant increase in the number of cases. If you look at our graph, it is quite steady. Last 24 hours, we tested about 85,000 people in India in a single day. When we started our testing, we were testing about 2,000 people in a day. Severe acute respiratory illness and influenza-like illness cases in all our unaffected districts also. States are also responding so well. And when you say the large number of cases, we just have about 55 to 60,000 cases in the country in last 3.5 months. Compare this number with the number of cases that these small countries have. Our mortality rate continues to be the lowest in the whole world, just about 3% as compared to a global mortality rate average of about 7.5%. They are all because of our aggressive testing, aggressive searches, and we want not even a single person to be left out. We want to catch every positive corona case in the society.
So what is the rationale behind India's current testing strategy and how is it adequate?
In the second week of May, we have expanded and augmented our facilities to 472 labs in the whole country, and it has almost 275 labs in the government sector. Almost 95,000 capacity that we have developed. This testing strategy is based on the advice of a group of experts which are guided by ICMR. There is a very clear policy, there is a very clear guideline and advice to everyone in the country about who needs to be tested.
But also there is a huge gap in figures being given by few states compared to the central government or the health ministry figures. Why is it so?
Actually, there is no discrepancy since the whole process is very dynamic process, starting from the tracing of the suspect patient to his or her testing, and then the report being generated in a laboratory, reports being transferred to the states, to the IDSP, to ICMR.
Okay, one very important question. what is the alternative for rapid test kit, which has been recently taken back from the hospitals after some issues regarding its quality were raised? Now, is there any mismatch between the supply and the demand of test kits in the country?
Tried to procure the kits at the fastest possible pace from the world wherever they were available, and we procured them, and when we found that they were ineffective, we immediately rejected their use for the society. On one hand, we are in the process of developing our own indigenous antibody test kits. Our scientists in ICMR have also developed an ELISA test, which is going to be a big, you can say, substitute or supplement to the so-called antibody test.
Dr. Harshvardhan, now doctors across country, you yourself is a doctor. Now doctors across the country are concerned about the shortage of personal protective equipment.
But this whole COVID-19 episode has turned out to be a blessing in disguise for the Make in India movement. We have over 100 manufacturers in the country which are tested and certified by now, and today they are manufacturing over 3 lakh PPE kits in a day, and the situation is such that we are distributing all these PPE kits to the states. So I don't think it's an issue at this particular time.
Now, apart from private laboratories, how is the government planning to involve the private healthcare sector in managing COVID-19?
You see, right during the initial phases of the COVID-19 crisis, I had called all these private doctors and the Association of the Private Hospitals and had appealed to them to help the government in handling the COVID-19 crisis. They had responded positively.
Dr. Harshvardhan, my last question to you is, how hopeful are you of being able to contain and mitigate this virus? Do you have any message for the nation right now?
Viruses will keep coming. There are so many viruses that have come to this world, and they have been affecting humanity in some form or the other. In fact, smallpox and polio virus, which has been eradicated at least from the Southeast Asia region and a couple of other regions of the whole world. Rest of the viruses are there in the world. They come and go in epidemic proportions. Sometimes they come and go in, they become endemic to certain areas, following social distancing, following hand hygiene, respiratory hygiene, using the masks in the society. All these habits ultimately will help us in strengthening our health.
Thank you, Dr. Harshvardhan, for sparing your precious time at these times when we are going through a very, very, very tough phase, and taking out time for us and helping us know more about what the government is doing. Thank you very much.